Equine herpesvirus can move through a barn quietly. One horse develops a fever, another has a little nasal discharge. A third may appear completely normal. Then, without much warning, a horse begins dragging a hind toe, stumbling, leaning against the wall, or struggling to stand. At that point, an ordinary looking respiratory outbreak may have become something far more serious. Equine herpes myeloencephalopathy, commonly called EHM. EHM is the severe neurologic form of equine herpes virus type 1, or EHV-1. It is the most feared infectious disease in the horse industry. Because effective horses can deteriorate rapidly, some become unable to remain standing, and severely affected horses may die or require euthanasia. There is no single universally proven cure for EHM. Veterinarians have primarily relied on supportive care, intensive nursing, antiviral medications in selected cases, and strict outbreak control. However, newly published research from Virginia Tech may offer an important clue about how veterinarians can improve a horse's chance of surviving an EHV-1 outbreak. Researchers examined what happened when horses exposed to EHV-1 received two medications with very different purposes. The first was Valacyclovir, an antiviral medication. The second was heparin, an anticoagulant. According to the study, horses treated with this combination had a lower incidence of EHM and dramatically better survival than the untreated horses in the outbreak study. Even more encouraging, some horses that developed neurologic disease survived and were eventually able to return to work. But before we call this a cure or begin treating every exposed horse, we need to look carefully at what the researchers actually found, how these medications might work, and the important limitations of the study. The research was published online in July 2026 in the Journal of the American Veterinary Medical Association. This was not a controlled experimental trial in which researchers deliberately exposed horses to EHV-1. Instead, it was a retrospective multi-center study. The team reviewed the medical information from naturally occurring outbreaks that took place between August 2017 and March 2018. That distinction matters. The researchers were looking backward at what happened under real outbreak conditions. Treatments were determined as veterinarians responded to sick and exposed horses, rather than being randomly assigned according to a controlled research protocol. Altogether, the study identified 111 horses that had been naturally exposed to EHV-1. Infection was confirmed through PCR testing of blood or nasal secretions. Of those exposed horses, 22 were confirmed to have EHV-1 and 9 developed neurologic disease consistent with EHM. The researchers then evaluated when the horses received Valacyclovir and heparin, whether they developed EHM and whether they survived. To understand the results, we first need to understand the difference between prophylactic and metaphylactic treatment. In this study, treatment was considered prophylactic when medication was administered before a horse developed recognized clinical signs of EHV-1. Those signs included a temperature above 38.6 degrees Celsius, or approximately 101.5 degrees Fahrenheit, limb swelling, nasal discharge, or neurologic deficits. Treatment was considered metaphylactic when medication was administered after clinical signs had appeared in a horse during a confirmed outbreak. 14 EHV-1 positive horses received both Valacyclovir and heparin metaphylactically. In other words, treatment began after those horses developed clinical signs. 5 of those horses developed EHM. Another treatment approach involving administering Valacyclovir prophylactically before clinical signs appeared, and then adding heparin metaphylactically after signs developed. Among the horses reported in that category, 1 developed EHM. The most striking comparison involved the EHV-1 positive horses that did not receive either medication. 4 infected horses were left untreated with valacyclovir and heparin. All 4 developed grade 5 out of 5 ataxia, representing extremely severe neurologic impairment, and all 4 were euthanized. By comparison, every horse treated with valacyclovir and heparin survived. That included horses that developed EHM. This does not mean that every horse treated with these drugs is guaranteed to survive. It also does not prove that the medications were solely responsible for the difference. However, the contrast in the outbreak population was significant enough for the researchers to conclude that combined treatment reduced the incidence of EHM and improved survival compared with no treatment. So, why might an antiviral and an anticoagulant work together? Valacyclovir is closely related to aclovir, an antiviral medication that interferes with the ability of certain herpesviruses to reproduce. Valacyclovir is converted into acyclovir inside the body, but it can produce more useful drug concentrations when administered orally. The timing of antiviral treatment may be critical. By the time a horse develops advanced neurologic signs, much of the damaging process may already be underway. Beginning antiviral treatment early, potentially before clinical signs appear in an exposed horse, may help limit viral replication before the infection causes widespread vascular injury. But EHM is not simply the result of the virus directly attacking the horse's spinal cord. EHV-1 can infect cells associated with blood vessels. This may produce inflammation and damage within the small blood vessels supplying the brain and spinal cord. Blood flow can become compromised, depriving areas of nervous tissue of the oxygen and nutrients they need. Tiny blood clots, hemorrhage, inflammation, and tissue injury can all contribute to the neurologic signs we associate with EHM. That is where heparin may enter the picture. Heparin is an anticoagulant, meaning it reduces the body's ability to form clots. In an EHV-1 case, the goal would not be to make the horse's blood incapable of clotting. The proposed benefits is to reduce harmful clot formation with damaged blood vessels and help preserve circulation to neurologic tissues. Put very simply, Valacyclovir is intended to target viral replication, while heparin may help address part of the vascular damage that makes EHM so dangerous. This two-part strategy makes biological sense, but it also carries risks. Heparin is a powerful prescription medication. Incorrect use can cause serious bleeding complications. Its administration requires veterinary judgment, accurate dosing, and appropriate monitoring. Valacyclovir is also not something horse owners should begin administering without veterinary direction. Treatment decisions may depend on the horse's exposure, clinical signs, diagnostic test results, medical history, and the circumstances of the outbreak. The cost and practicality of treating multiple exposed horses must also be considered. Antiviral protocols can be expensive, particularly when a large population has been exposed. This study should therefore not be interpreted as a do-it-yourself treatment plan. It is evidence that veterinarians can use when deciding how to manage horses during a confirmed outbreak. It may also help guide the design of larger prospective studies. The limitations of this research are especially important. Only 22 of the 111 exposed were confirmed to be infected, and only a small number of untreated infected horses were available for comparison. The horses were not randomly assigned to treatment and control groups. Because this was a retrospective study of naturally occurring outbreaks, there may have been differences between the horses or facilities that influenced their outcomes. Treatment timing, disease severity, supportive care, individual immune responses, and the management available at each location could all have affected survival. The researchers identified a strong association between combined treatment and improved outcomes, but a retrospective study cannot establish cause and effect as confidently as a large, randomized clinical trial. Still, Real-world outbreak studies are extremely valuable. EHM cannot ethically be recreated simply to test every potential treatment. When an outbreak occurs, veterinarians must make decisions quickly using the best information available. Carefully analyzing those decisions afterwards can reveal patterns that might otherwise be missed. In this case, that pattern was difficult to ignore. All 4 untreated infected horses developed the most severe grade of ataxia and were euthanized, while all horses receiving the combination treatment survived. The findings also emphasize how important early detection is during an EHV-1 outbreak. A fever may appear before neurologic signs. That gives barns, managers, and veterinarians a potential window in which to isolate the horse, begin testing, trace exposures, and consider treatment. During a suspected outbreak, temperatures may need to be checked at least twice daily and recorded for every horse. Looking at a written record makes it much easier to recognize a change from an individual horse's normal temperature. Owners should also watch for nasal discharge, depression, reduced appetite, limb swelling, difficulty urinating, urine dribbling, tail weakness, hind limb incoordination, toe dragging, unusual leaning, or trouble rising. Any horse showing fever or neurologic abnormalities should be separated from other horses immediately, provided that this can be done safely, and a veterinarian should be contacted. People can carry contaminated material between horses on their hands, clothing, boots, buckets, grooming equipment, etc. Separate equipment should also be assigned to isolated horses, and movement on and off the property may need to stop. If neurologic disease is suspected, do not force the horse to walk simply to see how unsteady it is. A neurologically impaired horse can fall unexpectedly and cause catastrophic injury to itself or the people nearby. Vaccination remains an important part of controlling respiratory disease and abortion associated with EHV-1. But currently available vaccines are not labeled as providing complete protection against EHM. A vaccinated horse can still become infected and may still develop neurologic disease. Vaccination, therefore, does not replace temperature monitoring, isolation, testing, hygiene, or rapid veterinary involvement. This study does not eliminate the threat of EHM. It does not give us a guaranteed cure, and it does not mean Valacyclovir and heparin will be appropriate for every horse. What it gives veterinarians is something extremely valuable: evidence from genuine outbreaks suggesting that early antiviral treatment combined with carefully managed anticoagulant therapy may change the course of this disease. Horses that might once have been considered unlikely to survive were treated, recovered, and in several cases returned to work. The next step will be further research with larger numbers of horses and more standardized treatment protocols. Researchers still need to refine which horses benefit most, when each medication should begin, how long treatment should continue, and which monitoring procedures provide the safest results. For now, the greatest lesson may be that timing matters. EHV-1 can progress from fever to devastating neurologic disease frighteningly quick. Recognizing the outbreak, monitoring every exposed horse, and involving a veterinarian before severe neurologic signs develop may create an opportunity that disappears once the diseased horse has advanced. This new research offers genuine reason for hope, but it is hope that must be paired with caution, preparation, and immediate veterinary care. We are not veterinarians, and this video is intended for education only. Never administer Valacyclovir, heparin, or any prescription medication unless it has been specifically prescribed and supervised by your veterinarian. Thank you so much for joining us. And remember, I am not AI. If you listen closely, you can hear all my mistakes.